The topic of discussion will be touching on issues of language access and discrimination when receiving medical care. Of Lynn residents, 55% speak a language other than English, and 41% are foreign-born. A key problem is lack of access to translation and interpreter services. So how can patients get access to a primary care doctor, any medical assistance, or care in their native language?
Sure, great question. I suggest that everyone contacts their primary care physician for further assistance. If you don't have a primary care physician, Lynn Community Health Center is able to help you. Our main site is located at 269 Union Street, and our phone number may be provided perhaps at the end of the segment. But we're basically open 7 days a week, and our hours vary, but we're open Mondays, Tuesdays, Wednesdays, and Fridays from 8 a.m. until 8 p.m., Thursdays from 10 a.m. until 8 p.m., Saturdays from 8:30 to 5 p.m., and Sunday we're open from 10:30 to 5. Lynn Community Health Center provides comprehensive care, including primary medical care, behavioral health services, dental services, eye care services, specialty services, pharmacy services, and a wide range of patient education and support programs. We have medical practitioners, doctors, nurses, and behavioral health staff, such as psychologists, licensed clinical social workers, licensed mental health counselors, and psychiatrists that are able to speak several languages. At Lynn Community Health Center, we are also privileged to utilize interpreter services, which also helps us best meet all of our patient needs in the language of their choice.
Great, thank you. So how are patients reassured that their private information is secured, specifically regarding residents who are undocumented and fearful of providing personal information that may be used against them?
Great. So patients' legal status is never shared with any other entity. And specifically at Lynn Community Health Center, for example, we believe a patient's protected health information is of utmost importance. We have something, we abide by something called HIPAA rules, and basically the HIPAA privacy rule provides federal protections for personal health information held by covered entities and gives patients an array of rights with respect to their personal information. So patient confidentiality is something that we take very seriously, and patients may be assured that their personal information will not be shared with others without a patient's consent.
Thanks. So is their immigration status asked about either when receiving a COVID test or visiting for any other sort of medical care?
Absolutely not. So we have many patients that come in for COVID testing on a daily basis, and their immigration status or their legal status or their citizenship status is never asked.
Thank you. There has been negative stereotypes and stigmas attached to COVID-19 in the US. There has also been a lack of racial and ethnic data reporting for case testing, which is now required so that a more accurate data tracking is done for those who are disproportionately affected by COVID-19. When those demographics data is requested and recorded, what procedures are taken to ensure that people of color, specifically those of Asian descent, are protected from discrimination when receiving routine healthcare or COVID-19 testing?
Absolutely. So it's important to note that patients' personal information is never shared, first of all, and it's always encrypted. So all of the patients' informations are kept in a secure manner and fashion. And I'd like to share that testing for COVID-19 is available for everyone at Lynn Community Health Center. You may be tested regardless of your symptoms, regardless of your exposure to COVID-19, and regardless of whether or not you are one of our patients. Having an appointment is strongly recommended, as limited walk-in appointments are available. Again, like I said, you do not have to be a patient of Lynn Community Health Center, and you do not have to have health insurance as well. Secondly, when it comes to your health as a patient, you do have certain rights. Lynn Community Health Center provides policies, and every health center and place where they administer medical care, they do provide and offer privacy policies which describe how medical information about you may be used and disclosed and how you can get access to that information as well. There is understandably concern about HIPAA compliance and the COVID-19 coronavirus pandemic and how the HIPAA privacy rule and security rules apply. in the age of HIPAA, no disease outbreak on this scale has ever been experienced, but what does stay constant is patients' confidentiality. It's important to remember that during any public health emergency, HIPAA compliance, and especially now during COVID-19 and everything surrounding that, all HIPAA privacy and security rules still do apply.
Great, thank you for providing us with a bit more detailed information about protecting clients when they do receive medical care. Okay, and that is that for those portions. Thank you very much, Dr. Cruz, for taking the time to speak with us and informing the viewers of best practices for slowing the spread of COVID-19 and also addressing concerns that meet the needs of our community. Very nice.
Thank you so much. Thank you for having me.
Thank you.